Now, Prof, this is one issue that I made an observation the day after the announcement, or on Monday. The scientists, the professionals, the virologists that I have heard speak so eloquently about this situation and help educate people, I discovered that suddenly had a difficulty explaining the science that the president says backed this decision. Most of them could not say straightforward that the decision was a good one. What do you say?
Thank you very much. In actual fact, before we can have a good understanding of this science business, we have to ask ourselves some fundamental questions. What is science? If you don't answer that question, you will never answer it properly either. If you don't ask that question. You see, science is a very heterogeneous discipline. We have physical sciences, biological sciences, chemical sciences, natural sciences. Mathematics is a science.
Social sciences.
Social sciences. So you see, the challenge is when you begin to consider science as mathematics and only mathematics, you will definitely have a problem. In my view, from the understanding of science and basic disciplines, the president is 100% right. Because if you were to look at everything just in the context of social science, there's a lot to talk about as far as taking the decision is concerned. You see, now let's look at one thing that the president said: contact tracing. So we had COVID-19, which initially we didn't even see it in the country when we started testing. Then Uguchi, we were at the forefront. And then later on we found that, look, COVID-19 is here, but it is imported cases. Then later on we found that, look, COVID-19 has entered the community and community transmission has started. You see? And then the president takes a decision, a leadership government decision, to lock down. Before lockdown, a lot of interactions are taking place. Even the Ghana Academy of Arts and Sciences has taken strategic moves and even met the president in the presidency. I was a member of the team that went. So many things have happened. Now, if you take even the mathematical science or the epidemiological science, take contact tracing. If you identify one person who is infected, potentially transmitting, and you do contact tracing, and you find that this person had had very, real contact with, let's say, 50 people, and you quarantine the 50 people, and then you look for whether any of them had acquired the infection, contracted the infection. And you find that out of that 50, maybe 0, or 1, or 2. It tells you something about the signs of transmission, what's happening, you see. And then the president did something else as a national government decision to also begin to do social, community screening, which was inputted by many, many stakeholders, including the Academy of Arts and Sciences. You see, so the community screening provides additional information on what is happening out there in the open community. And if you screen 100 people, and you were to find that 70 of them are infected, or you screen 100 people and you find that 2 are infected, or 1 is infected, It is science, it has meaning. And based on that meaning, you can take some decisions. Now, assume you screen 100 people and found that 70 are infected. I believe it will be wise for you to lock down. Because if you don't lock down, the remaining 30 will soon be also infected. You have to lock down and manage the situation rigorously, more, intensively. But if only one is infected, then you weigh it against other, and the president said it, other social and economic factors. What is the average strength of the Ghanaian family in terms of standard of living, ability to even get food to eat? There are families that if they don't interact with externally for a day, 2, 3 days, they will not eat. They won't eat at all.
Yeah.
Maybe some people are in Ghana, they don't know what is poverty. I know what is poverty. I know it real, as personal experience when I was a child. So please, you don't joke with these things. Because eventually, if you really understand epidemiology and disease transmission and epidemics and pandemics, you will understand that, look, if you are not careful, depending on where your people, the majority of your people fall in even nutrition and what do you call it, balanced diets and deficiencies in diets, if you don't know and you are not careful, what you will realize is that you will compromise the ability of people to be able to even withstand COVID-19 infection to the extent that even immunocompromisation will appear to be the case. That is why when HIV/AIDS came, you remember, was it Becky Tambo, Becky, South African president? When he said that HIV/AIDS is not caused by any virus, but it's caused by poverty, is by nutritional. You understand? These things are intertwined. In today's science, in biomedical research science, we know that, look, nutrition and even immunology. So we talk of immunonutrition. So to say that there is no science really, it's because we have not defined what is science.
Okay.
Thank you.
Right. Well, Noguchi obviously has been doing such a big job, and people have been concerned that, we ought to have paid a lot more attention to Noguchi long before today, as they get overwhelmed. They also have been doing through what we are getting to know now, which is seeking to settle some of the doubts that people had, that they are doing the polling, sampling, so to speak. And that explains the good numbers that they are doing. Now, right, the president banks his hopes on the fact that we are doing, among other things, advanced testing. Over the period, we have done only how many? Less than 80,000 so far. We are talking, and I keep referring, we are talking about real testing going on elsewhere. People are doing 10,000 a day. People are doing 20,000 a day. The US, for example, is seeking to do 5 million tests a day. How can we boast in what we are doing, which is so little?
Thank you. And I'll take my, I'll have my take on the president's issue, president's decision as well. But first of all, I have a few preliminary comments. I think I have to express great respect and gratitude to Noguchi and the very brilliant and valiant scientists there that are at the forefront of this fight. We have absolutely nothing but respect and gratitude for them. And
thank you.
They are all our heroes, absolutely. In the public health emergency, and here I agree with Professor Annan and Professor H. Kwesi Prempeh, that you do need to be multidisciplinary in the way that you look at things. And I was quite impressed when Noguchi and Warbrick announced the genome sequencing results, and everybody was praising the biomedical scientists that were involved. But surprisingly, they'd forgotten the computing and the IT technicians who enable the throughput, the high throughput sequencing that you need to actually get the results.
So obviously.
So it's a highly interdisciplinary area, and it's a big mistake when people think that there's some kind of hymn sheet of science that every expert has to sing from.
Yeah.
In fact, in every sophisticated society, there are competing models. You have University College of London has a different way of looking at it. Imperial College has a different way of looking at it, because the variables are hundreds and hundreds and hundreds.
Exactly.
So in that respect, we should expect that there will be different views. And therefore, I was not surprised at all that we had people who were coming from different disciplines, pathology, because they were responsible for managing the case, and are concerned about risk in the wards and things like that, having a different view from epidemiology. That's beautiful. So I was shocked that in some of the comments, it appeared as if people thought that was some problem. We should expect this kind of robust engagement. The other thing that I also think is kind of important is that data, which is the point that Prof. Prempeh made so strongly, is critical. Data is critical because without data, an expert or a scientist is no different from you and I. The reason why they are more superior and why their views matter more is because often they have the right data and the skills to interpret that data. So data is very critical. And that is why I was a bit surprised about the decision by the president not
You
to...
need to take your time and adjust it well, unless you get it over the spectacles. Okay.
Okay.
Great. All right.
I was a bit, I don't know what to say, worried or anxious when the president, in announcing the removal, did not have the right team at the Ghana Health Service publish a more comprehensive analysis and say, here is the modeling that we're working with, so that the discrepancies in minor data issues that were creating some of the contests, which was more than a contest of ideas and was veering towards distrust and mistrust, will be abated. Let me give you a reason why. If you just look at the data as it's available, first of all, the data that is in the public domain, the general data, it's very difficult to use it for any kind of analysis. The one that they display, the media typically display. But there are situational reports, and in those situational reports, you can do some of the granular analysis that Professor Prempeh was talking about. So I have taken my time with the help of Imani to try and look at the Greater Accra data points very carefully and to try and see how it accords with the president's view. And I was impressed to learn that when you segregate the data along three major axes, if you take those that were sick and went to a hospital, or they called the hotline because they were sick and then there was a follow-up. So those have symptoms and have perhaps clinical manifestations. We call it routine surveillance. If you take that data, a range of data, you compare it against the community screening, where they set up perimeters and then they test randomly as much as they can, versus the enhanced contact tracing, where they are tracing primary and secondary contacts of people that were confirmed positive. There is significant variation in the positivity rates. And I think that is where the analysis should focus. So when you look at the routine surveillance as an example, that is people that are feeling sick, maybe they have flu-like symptoms, and then they go to hospital or they call, and then clinician does a preliminary diagnosis and then refer them for confirmatory testing. When you look at that segment, we are close to 9% positive rate, close to 9%. That's very significant. I'm talking Greater Accra. In the broader community screening, segment is less than 0.5% from the data that I'm looking at. It's a day old, but... And then when you look at the enhanced contact tracing, it's close to 8%. What does this mean? A couple of things. One, it means that there is a possibility that how we design our community screening using the spatiotemporal analysis of the data to figure out where should we go and do random tests may not be as sensitive as the other categories, which is normal, right? Because if somebody is feeling sick, already there is a certain degree of suspicion, so it narrows it down more. And if you are just doing random testing. However, where you have a situation where your community screening is yielding very little, and yet for your enhanced contact tracing is yielding significant numbers, you have to start questioning the model in which you are doing your random sampling, your perimeter sampling. The second point that is interesting from the data is that when the president announced that he was going to lock down so that they can improve the quality of the tracing, we did see indeed from the data that the enhanced testing regime was indeed enhanced. So by the end of that week, they had as many as 5,318 contacts across Greater Accra region, of which almost 5,000, about 4,969 samples have been taken. And this was in 6th April, at the end of the first week. So you could, and the ramp up was very sudden, from about 600 contacts to about 5,000 and more contacts. So the data aligns with the president's statement then that we are locking down so we could do testing more effectively. The problem arises where by the time the president decided to unlock, tracing had declined to the point where we had, on 19th April, just a little above 2,000 contacts being traced. You understand my point? Just a little above 2,000 contacts being traced. And only a little above 1,000 samples being collected. Now, my argument would be that already, before the president announced the lockdown, there had been a step down in contact tracing and sampling. And therefore, an explanation is owed the public, whether that was based on a risk analysis that somehow we have a better handle of this problem, and therefore we don't need to trace as much and test as much. Or we have a resource problem, which some of us hear on the grapevine. And that is a very important point. In the absence of data, different experts, particularly those who have, different experts who look at this from different disciplines, and because the official data is not there, they are calling their friends in the laboratories and the rest of it, form a different opinion operating on half data. Because I can see an epidemiologist with good biostatistical background or bioinformatics background looking at data and saying that, well, the situation may look like it's not that bad for 3 reasons. You are tracing less towards the end of the lockdown period, and you are sampling less. So perhaps given that situation, the impression that is being created at the level of the highest levels of government is somewhat rosier than it should be. Another person will say, look, we have a surveillance challenge in this country. We have a weakness in our surveillance system, both our passive and our active surveillance systems in this country, because we know that in 2017, our routine surveillance failed us in the H1N1 outbreak in Ghana, as you remember, in Kumasi, where 4 young students in Kumaka died. It was an autopsy which revealed that they had died of H1N1. Now, if you have such a situation, you have such historical evidence on hand, that there may be weaknesses in surveillance, even for influenza, where we have a national influenza center, very advanced system, sentinel sites all over the place, then it is possible that given the limited amount of enhanced contact tracing that was being done toward the tail end, some of the active case search results were not fully representative of the true situation on the ground. So what is the solution to this? Much more data, much more insight into the analysis, much more data, much more insight into the analysis and the model building that enables the decision to be taken whether we are seeing a decline or a rise in prevalence and incidence. The other thing that I also observed from the data was that the epidemic has moved into high density areas. So we've always known that Ayawaso West and Ayawaso East are major hotspots. But in a few days, Ayawaso Central, which has some of the highest spatial densities in this country, so I'm talking about Mamobi, Nima, Kanda area, have started to shoot up very dramatically. But even worse than that, the socioeconomic links between that part of the city and Accra Central is very interesting, because you're not only looking at the static picture, but also you are looking at the evolving picture. And if you look at the links between that part of town to people that work in Tudu, people that work in other parts of Koleklote, which I'll come to, and Accra Central, particularly that Macaulay area, Jamestown, etc., etc., and you find out that there's covariance. So when we did the data analysis, you find out that when this is moving, it's moving in tandem with movement in case detection in another part of the country where there's strong socioeconomic links. It gives us an insight into why the Koleklote problem was not detected early. Remember when they said we're going to do randomized testing and intensify it in Ayawaso? They did not add Koleklote. And yet, in a very short period of time, Koleklote now is a major hotspot, outstripping Ayawaso.
So what I'll do is that we will take a break, and when we return, we'll have Professor Annan respond to the very interesting, analysis that have questions in them that you have just done.